God, Church. Today is PCEA Drug Awareness Day. As Health Board, we've prepared a talk for you, which will be brought by Getrude Kanyua. Getrude Kanyua is a community-registered nurse, clinical psychologist, community health scientist, sexual forensic examiner, trauma and mental health practitioner, and also a mediator. She is a consultant at AMREF International, Village Hope Corps International, and also works with various churches and schools, among others. She has worked at Kenyatta National Hospital for over 35 years, serving in various departments, including mental health department as the nurse in charge until retirement. She is a member of Pediatric Association of Kenya, International Sexual Forensic Examiners, Kenya Nurses Association, International Association of Forensic Nursing, and Kenya Professional Counseling Association.
Effects of alcohol and substance abuse on mental health. Alcohol and substance abuse is a monster in our society. Let us all come together and fight it. An impossible monster? It is not. Together we can fight it. That is why we are here today in the church as a community to look for ways and share. Alcohol and substance abuse affect people differently. Frequent questions asked include, how does alcohol affect my mental health? What does alcohol do to a depressed person? Does alcohol worsen my anxiety? Why does alcohol make him emotional? Even in this room, as we are seated, you may be thinking about all these questions, and you will find there are questions which we may be asking every other day, including some of us who are seated here. Alcohol and substance abuse affect people differently. They are frequently asked questions. Some of these questions include, how does alcohol affect my mental health? What does alcohol do to a depressed person? Does alcohol worsen my anxiety? And why does alcohol make me emotional? Like, for example, when I talk about alcohol making me emotional, you'll find that some of people who are taking alcohol, for example, you may see somebody just crying from nowhere or laughing from nowhere or even crossing the road, just laughing. But you wonder, what is so funny about this person? And we need to ask ourselves, who are the most affected by substance abuse? And when we talk about substance abuse, alcohol is part of it. Based on my own experience, having worked with clients for very many years, especially in Kenyatta National Hospital, where I've just retired from, I've come across many people who are affected by alcohol and substance abuse, being underweight, young people, especially the youth, our young daughters and sons, new consumers of alcohol. Why new consumers of alcohol? The body is not used to it, so the minute they taste it, even if it is on a small amount, they are easily affected and they go down with it. And then they even have this bizarre behavior. Alcohol and substance abuse slow down brain functions, slow down body functions. It affects the way we think, the way we feel, and even the way we behave. The way, when I talk about affect the way we think, our judgment is affected. How we treat others, how we even treat our own family members, how we act, how we think, or how we plan our day-to-day activities is totally different from somebody who has not abused any drugs. Unbalanced walking. Many of us you have seen, even people walking on the way, they have no balance. They are walking the way they want, they are falling, they are waking up, they are sleeping on the roads. This is not about them. It is because they are influenced by the alcohol and the substance abuse in their bodies. Some of them, they have nausea and vomiting. Nausea is that feeling of like you can vomit. but the vomiting itself is the actual vomiting. They vomit a lot because the body can't resist, the body can't cope with the drugs in the body. There is memory loss. Some of them, they don't even remember most of the things they did. And that is why you'll see when they are not drunk like alcohol. We have all seen that people, he may be abusive, he may be laughing carelessly, he may be, but if you ask him the following day how he was behaving, he'll not tell you, because that time it was the alcohol which was influencing them. But now, the memory, they can't even remember what they were doing. They can't even remember to go to work. They can't even remember that they abused somebody. And that is why sometimes you see they shy off, they go into denial, and some of them even isolate themselves. There is impaired judgment. Making a judgment becomes a problem. That is why some of them, or some of them may be involved even in sexual violence. Because the judgment they make is not the judgment made by a person who has not abused the drugs. They just decide and they do it. They don't have a second thought. They just act and then they regret later. What about death? I've seen some of our people die of alcohol. Some of them, the dead not maybe just because they have died of what they are drunk, but they are even killed by mob justice because of the behavior they are behaving. Some of them drink, they go into coma, and they end up dying. Other effects may include injury to themselves. They may injure themselves, including hurting their own body, and to others through fighting and the rest. They are prone to accidents. You'll find that the accidents they have is not the normal accident. There is increased risk of suicide. They commit suicide very easily because of the influence of the drug. There is increased risk of diabetes. This is a medical condition. There is impotence in men, cancers, different cancers in the body, infertility to both men and women. There is high blood pressure and other medical conditions. And when we come to social and financial effects, they are many times involved in criminal activities, may affect their personal, work, and family relationships. How do we manage this? Intervention and treatment may include support from family members, friends, church, like the way we are here, community, which the church is part of the community, and the state. Individual or group counseling, this is where people go as individuals to a specialist, the counselors, psychologists, and the rest, and then they are helped individually. Group is where they meet. As a group of them, they discuss together. Those who are down are brought up by those who have been attending the sessions, and they end up supporting one another. Hospitalization. This is whereby the condition has deteriorated, and they go to the hospital where detoxification is done, and those with withdrawal of the substance abuse, they are managed by doctors and other health team members, and they are hospitalized. Some of them may stay even for a couple of months, like 6 months or so. If you want to contact me for more elaboration or even for the service, please reach me on contact. My cell phone number, which I use day to day, is 0722-395-319. And my email is nyakohito@yahoo.com. Thank you again, and God bless you always.
Thank you, Getrude, for that powerful talk, and you church members for listening. As Health Board, we are committed to bringing you more of such talks because your health is our priority. On 7th July, we will have a mental health talk here in church, and we look forward to engage with you. Thank you so much, and God bless you all.